And we also have Denise Hess, if you would please brief us on your program.
Thank you. I'm Denise Hess. I'm the Executive Director of the Supportive Care Coalition and here representing the Association of Professional Chaplains, and just want to thank the Academy and Bryn and Brenda for including the chaplain voice in this conversation. Professional healthcare chaplains are facing all of the above, the same healthcare and workforce issues as our interdisciplinary colleagues, but for slightly different reasons. Just so we're all on the same page, I want to start by defining what a chaplain is. There's still a lot of misperception about that. We are trained and preferably board-certified healthcare professionals, for those of us who work in healthcare, chaplains work in many settings, who are there in service of the people around us, whether that's people in the bed, people beside the bed, or folks who work in healthcare, to help those people utilize their own internal spiritual and emotional resources in service of their healing. So you'll notice I didn't say anything about pushing a religious agenda or proselytizing, two of the biggest myths, I think, about what healthcare chaplains are. So we have two primary workforce issues I'd like to highlight for this audience today. First is that we have a very high variability of professionalism in our field. We don't have the workforce data of our colleagues, but estimates say there are probably about 10,000 chaplains working in the United States today, and again, in multiple types of settings, not all healthcare. Among that 10,000, it's estimated that less than half are board certified by a nationally recognized certifying body. This results, as I said, in a very high variability of professionalism in our field. So why is this kind of situation allowed to persist? Unfortunately, healthcare chaplains are one of the few remaining healthcare professionals who are not required to be board certified or some equivalent upon hire. Not even necessarily within 2 years of hire. We need employers to change that. We need employers to write into the job descriptions a requirement for board certified chaplains, either upon hire or within 2 years of hire. Secondly, we have great underutilization of chaplains in the serious illness workforce. The industry guidelines have been highlighted several times this morning. National Consensus Project guidelines clearly include the spiritual domain, reference that that domain can be and hopefully should be addressed by a professional chaplain. Yet the latest data that we have from the Center to Advance Palliative Care says that 60%, about 60% of interdisciplinary palliative care teams, so teams that should have a physician, advanced practice clinician, nurse, social worker, and chaplain, 60% of teams are incomplete. And the discipline, the team member most often missing from those incomplete teams is the chaplain. We need you all, our interdisciplinary colleagues in the serious illness population, to advocate for us, hire us. We're really the best value. We're cheap. And we can do a lot if we're allowed to practice at the top of our license. There's a little bit of data. There's a growing research base that indicates that we can have a positive effect on outcomes that are very important for reimbursement. And of course, there is a growing data base about how patients with serious illness want to talk about their spiritual, emotional, existential needs with us. It's important to them. It matters to them. They feel like they're cared for as whole persons. So we need you all on the palliative and geriatric teams to staff up. And not just staff up with any old chaplain, choose a board certified one. And better yet, choose one that has specialty certification in hospice and palliative care. So like our social work colleagues, as Barbara just highlighted, in 2013, 2 of the major chaplain certifying bodies introduced a specialty certification for chaplains in hospice and palliative care. To date, just under 40 chaplains have received that certification. We have not seen the uptake as our social work colleagues have. We would like to see that uptake. We need your help in changing and accelerating the demand signal. The demand is not there. Again, back to the CABC data. We would also like to just put out there as our kind of final call to action. I'm speaking on behalf of many of my chaplain colleagues that I interviewed prior to this, is that just as I don't think anyone on a professional interdisciplinary healthcare team would consider for a moment hiring an unlicensed or non-board certified physician, advanced practice clinician, nurse, or now social worker, we need to raise the industry standard so that it is the norm to hire board certified and or advanced and specialty certified chaplains. So thanks so much for having us.